Hello. So I'm going to take a few minutes today to talk to you all about migraines. So we'll just review the types of migraines, who gets them, and then the biopsychosocial spiritual model about how they onset. We'll cover the standards of practice in medical treatment of migraines, and then we'll also cover psychological treatment of migraines. And I'll leave you with some resources to help to manage if that is something that you deal with on your own. In terms of an overview of what migraines are, so migraines are considered a primary headache disorder. So this means that it's not a result of any other, it's not a symptom of another condition, it's not a result of any other condition, it's a condition of it on its own. So you can have migraines without auras, with auras, or chronic migraines. Those without auras have 5 migraines that last 4 to 72 hours, causes them to have to miss out on or avoid their regular routine just from that, the experience of being in so much pain. Can also have some physiological symptoms like vomiting, nausea, light sensitivity, or sound sensitivity as well. So those who do have more auras have all these same things, but they'll also have this experience of visual, sensory, so like maybe a taste in their mouth, types of events that'll happen just before, about 5 to 60 minutes before a headache will onset. So this can be things like feeling pins and needles, seeing a bright light, having trouble speaking, etc. And then the aura typically spreads. It might start small and then spread into more. And then a chronic migraine is, depending on with or without aura, but it's those same symptoms with 15 or more headache days per month for 3 or more months. So this can just speak to the experience of incredible pain that someone might be in. And so the 4 phases of any migraine that onset is going to be, or the onsets is going to be this prodromal period where there could be problems concentrating, irritability, fatigue, those sensitivities might start to happen. And then there's an aura, and that can happen up to 3 hours to several days before the onset of a migraine. Then there's the experience of those who have auras, who again, up to an hour before the onset of the headache, they'll start to have those sensory experiences, followed by the headache itself, which can last anywhere from 4 to 72 hours. And then the postdromal period, where this person might be feeling depressed. They might feel an experience of euphoria or just like really high positive feelings, but then also the experience of fatigue within their body or their mind. So it's an incredibly difficult experience. You can imagine if these 4 phases are taking place for more than 15 days a month, then there's really probably not a day or not a lot of days where a person is feeling really good. It's important to consider what a migraine is not. So a migraine is not a headache. It's not just a headache. So a lot of us get headaches, and that means that we'll probably need to drink some more water or take a rest, and then we can kind of get back into the swing of things after a while. But we might experience things like tension headaches or cluster headaches, or even headaches from things like coughing, sex, external pressure, or head injury. It could also be caused by an underlying issue or another. So again, migraines are a primary type of headache, and a secondary headache could mean that something has happened or there's another diagnosis that also comes with headaches. It's important to know the difference because these are very different kind of experiences. So migraine is a neurobiological condition that it onsets. So there are people who might have more sensitive pain pathways, and a migraine tends to aggravate that. And then we have people who experience auras, and there's a theory that cortical spreading depression is something that happens in which there is an imbalance of blood flow to these major regions in the brain, which causes it to start to have those sensory experiences, and then they spread into other areas as well, or they spread into a larger sensory experience. Migraines are also more commonly found in women. They're more prevalent in women. So understanding there could be a biological factor there. But socially, again, so this is no longer considered a psychosomatic condition, meaning that it's not something that maybe we'll think like, oh, your brain kind of onset that. So you started to maybe think about or kind of have an experience of migraine, and then that worsened because of this maybe psychological reasoning. But instead, we know it to be a neurobiological condition that requires specific types of interventions. So clients a lot of times have difficulty explaining what actually it is that they're going through, which can be incredibly isolating. And then there's also maybe an experience of people in lower income and education levels who are more likely to experience migraines. In terms of psychological experience, the experience of being really isolated, as well as having these biological factors, like being a woman or what have you, those things kind of coming together and causing migraines can also lead to more common things like anxiety and depression as a comorbid or an accompanying diagnosis. Again, if someone's feeling fatigued all the time or they're feeling extremely depressed, then they might withdraw from regular routines, which continues the cycle of stress and tension. And there also might be a preoccupation with pain. So these can be all types of things that take away from a person's experience of well-being. And spiritually, so there can be things that are helpful, like prayer, meditation, that can help to reduce the experience of migraines. However, sometimes people's stress and fear around maybe this is spiritual warfare or that there are spiritual causes to the auras that are not biblical, like those can be things that are that cause tension and stress or add to tension and stress. In terms of the medical standards, there are preventative treatments like prophylactic drug regimens that help to maybe prevent the onset of a migraine. Beta blockers, again, if they're more sensitive pain pathways, then beta blockers are going to help to reduce the experience of pain. Then during active treatment, there are things like sumatriptan, which are really helpful in medical emergency situations. And then antiemetics, which help to reduce the experience of nausea and vomiting. But combined therapies are going to be the most effective. So how do we consider when to seek out these combined therapies? So we have a drug regimen that could be helpful, but what else do we need? So psychological treatment tends to be indicated if maybe there are medical conditions that make it more helpful to have a psychological component that's here as well. So for example, someone who is pregnant or lactating could need to reduce the amount of medication they have in their system. Same thing for someone who might not respond well to medication or who just has a lot more difficulty actually coping with their stress, which makes the migraines worse. So in terms of we tend to act in terms of preventative measures in the psychological field. So in terms of an active treatment for a migraine, again, this is a neurobiological condition, so it's not as much of a active treatment that's going to be helpful, but more so what happens just before and just after that migraine. So psychoeducation to know what those triggers are, cognitive behavioral therapy, biofeedback, relaxation training, et cetera, which we'll talk a little bit more about just now. In terms of biofeedback, this is an experience of learning to control these involuntary functions. So like your blood vessels constricting and relaxing, like how do we actually do that? So if you ever notice that when you feel anxious, all your blood tends to rush to your vital organs and things like maybe your hands and your feet will start to feel cold. So because of this, if all that blood is rushing to those different spaces in your brain and into these vital organs in your body, it's going to be important to start to do things like maybe rubbing your hands together to warm your hands back up and start to relax your body to get the blood back into these other areas of your body. Then relaxation techniques like progressive muscle relaxation helps a lot in terms of being able to keep your body in a state of relaxation rather than expecting it to just only relax when it's time for when a migraine comes on. So at that point, it's a little bit late. So you want to take the time to practice throughout. So that one has a fast relief rate. So we want to definitely employ that one whenever possible. And then cognitive behavioral therapy, which takes elements like psychoeducation. Again, what are your triggers? What is it that happens just before or just after a migraine that makes the experience of this much worse? We want to do things to improve a person's self-perception and their pain-related cognitions. If thoughts around the migraine are just desolate and despair, then that experience of migraine is going to be very, very hard to cope with. And then just to get them again back into their regular social routine. So we tend to feel better when we're in our routines, we're feeling like ourselves. So being able to do that is also going to be incredibly important. And CBT is helpful in a lot of different people, as well as a lot of different communities, but especially here for chronic migraines and in children. So I just wanted to point out these less evidence-based procedures because it just points to the fact that people really are out here looking for a cure. So I want to give you a little bit of encouragement if this is something that you're looking for in terms of the resources that are available for management. So the Migraine Buddy is an app that is on your phone that's going to help you to maybe cope with this experience of migraines by building communities. You can connect with other people using specific hashtags on other social media sites as well. Through psychoeducation, again, if you know better, you're able to kind of act in a better way. And then skill support, so teaching exactly how to manage those skills. And the National Headache Foundation has a podcast where they talk about really what the latest and greatest is in terms of the community of people with migraines. And finally, Facebook groups, again, building community and not feeling like you're the only one, even if you are maybe the only one in your friend group or in your family group, being able to find other people who have a similar story can be something that's incredibly encouraging. So that is all I have for you today. I hope that this was informative and that this could be helpful in terms of understanding more about what migraines are.